I'd like to welcome you to the Impact of Gender in the Drug Court Setting 101. My name is Paul Warren and I'll be your trainer for the day. Before we begin with the actual content of the course, I'd like to take a moment to go over logistics so that you can participate actively during this webinar. Right now you're looking at your control panel, and I'd like to draw your attention to a few features of the control panel that I'm going to ask you to use during the course of the webinar. The first one is that you can actually move your control panel out of the way if you want a better view of the slides. You just click that orange box with the white arrow, and then if you want to restore your control panel, you just click it again and it'll come back. During the course of this webinar, you can ask questions, type questions to me at any time. If I'm able to respond to them during the course of the webinar, I will. We'll also have a formal question and answer period, but you're more than welcome to ask questions during any time during the webinar. And again, you'll see that this red box is where you can submit your questions, and you'll want to type in the area that my cursor is pointing to right now. During the course of the webinar, I will also ask you to raise your hand. And the little box that's being pointed to now with the yellow hand and the green arrow is actually where you will click to raise your hand when I ask you to do that. So why doesn't everybody give that a try with their control panel right now? Go ahead and raise your hands if you found that feature on your... Yes, I see that Lori has done it, Suzanne has done it, and Nancy has just joined them. Excellent. So people are raising their hands. Wonderful. And the few other people who have not raised their hands, again, please note that where my cursor is pointing right now is where you'll actually be asked to raise your hand. Thank you very much, everybody. I'd also like to draw your attention to this 800 number. If you're having any difficulty seeing the webinar or hearing the webinar, please use this number during the course of the webinar to call for technical assistance in regard to it. This number will also appear on the bottom of slides, some slides throughout the webinar. Also feel free to write this number down for your own convenience if it's actually not on a slide and handy at that particular moment. I'd like to thank the Bureau of Justice Assistance, American University, for the opportunity to do this webinar. This is a collaboration between BJA, AU, the Training Institute here at NDRI, and my name again is Paul Warren, and I'll be your presenter during this webinar. Just a little bit about me. I am very happy to be doing more webinars for your group. The ones I did earlier were on co-occurring disorders. I've been a staff member here at NDRI almost 10 years now, and I'm a social worker by training. I want to draw your attention to the picture and the name of this particular individual, Stu Rasmussen from Silverton, Oregon. And I would like you to keep your eyes peeled during the course of this webinar for when you will actually see Stu again. I'll ask a general question so people can also practice raising their hands. If you know who Stu Rasmussen is, and you're familiar with who Stu Rasmussen is, please raise your hand right now. Okay. I'm not seeing anybody raising their hands. No, I'm not seeing anyone. That's good to know. So we'll come back to Stu during the course of the webinar. Let's talk a little bit about the goal of this particular webinar. Primarily, my hope is that you will complete this webinar with a deeper understanding of what gender actually is and means, and how it relates to your work in drug court and on your drug court teams. The thing that I'd also like you to really consider in terms of one of the goals is the importance and relevance of addressing and considering gender in the drug court setting. We have a few specific learning objectives that I'd like to accomplish during the course of the webinar. First, my hope is that you will be able to state the difference between sex and gender, that you will be able to define what gender-specific programming actually means in a drug court context, that you'll be able to identify at least 2 factors that cause women, specifically women, to commit crime, that you'll be able to list at least a minimum of 2 practical ways to address gender in drug court. You'll be able to state some primary reasons why it's relevant, important to consider gender, and use truly gender-specific programming in a drug court setting. And also, we'll close out the webinar in preparation for the next webinar, identifying some gender-specific stereotypes associated with women and men. I also want to draw your attention to the bottom of this particular slide. You'll see that the technical support number appears there. As I said, it will appear on upcoming slides as well. So, I'd like you to take a very good look at this child. And I'd like you to answer for yourself what sex you believe this child is. So take a moment for yourself, take a look at the picture of this beautiful child, and decide for yourself what sex the child is. All right, let's talk a little bit about what we mean by sex at birth. When we talk about sex at birth, what we're talking about primarily is biological concerns. We're talking about biology. We're talking about chromosomes, and we're talking about genitalia, whether you have a penis or whether you have a vagina. That's primarily what we're talking about at sex at birth. Things that also are associated and relate to that are secondary sex characteristics, such as hormones, hair, body fat distribution. And when we're considering sex at birth, consider that there are truly 3 sexes: intersex, female, and male. And let me be clear what I mean by intersex. It may be the first time people have heard that term. If you've actually heard the term intersex before, please raise your hand. Okay, Lori has heard the term before. Excellent. Lori is the only one at this point who's indicated having heard that term before. So Lori, you'll have to tell me if you think I captured it. Intersex, simply stated, is an individual who is born naturally with either ambiguous genitalia or genitalia of both biological sexes. In the past, intersexed individuals were often referred to as hermaphrodites. What I'd like to suggest is that that term is not a term that is used any longer because it's often associated with exploitation. And intersexed individuals prefer the term intersexed. Let's move on to gender. I'd like you to take a look at this particular child. And I'd like you to think about what gender is this child. Take a good look. Make your decision and be prepared to vote. We are now going to launch our first poll. Excellent. I see that people are voting. Excellent. 83% of you voted, so people who didn't get a chance to vote, you're going to have to vote faster. The poll has been closed, and you are, I presume, now viewing the results. Now, 40% of you voted that this individual was a boy, 10% of you said unknown, and 50% of you said no way of knowing. Excellent. We've started in a very good place. You'll notice I'm not revealing the gender of the particular child. We'll come back to that. When you think of gender, if there's one piece, it is my great hope that you will take away from this webinar, is that when you think of the word gender, you do not think of the word sex, but you think of the word cultural. Gender is a culturally derived and defined expectation of maleness and or femaleness. Now, what I would add to that that's not actually on this slide is that gender is actually on a continuum. We'll cover that more in the next webinar, but generally in our culture, webinar is framed as femaleness or maleness, and that is often referred to as the binary myth. A for females, B for males. What I've come to find out during my research in regard to this topic as it relates to drug court is that gender in drug court, in the drug court setting, primarily is framed as binary, and it's primarily based on sex at birth. And remember, we said sex at birth was chromosomes and genitalia, a penis or a vagina, and it's often framed as binary. And this is my understanding of how it's framed in the drug court setting. Gender-specific and gender-responsive programming in criminal justice, in drug courts, in most of the research, if you Google those terms, generally refers to women. Gender-specific and gender-responsive programming generally refers to programming for women. An idea that I'd like you to consider is that one size does not fit all. The term gender neutral or gender neutral programming is a term that is often used, and the idea behind this particular term is that the program that has been developed is for women and for men, and it's gender neutral. We treat everybody the same. One thing I'd like to suggest in regard to gender neutral programming and even gender specific programming is that most gender specific programming that women participate in was actually created for men. And the programming is being offered to women with the same approaches that were applied to men, but only women are in the group. The thing I'd really like you to consider and think about in the course of this particular webinar is how effective that truly is. Programs that were made for men being used for women. We are now about to launch our second poll. And feel free to vote. Okay. The votes are in. The poll is closed, and the results are being shown. 50% of you responded that you offer gender-neutral programming. Programming that's the same for men and for women. And 50% of you also said that you offer programming made specifically for both men and women. I'm very glad to hear that, and I hope that that will come up during the question and answer period. Excellent. We can now hide these poll results. Excellent. We're now ready to move on. I'd like to suggest, and I am very glad to hear that there are drug courts that are using programs that are specifically developed for both women and for men. I want to throw out some information about some emerging areas of focus, which are, and you may be familiar with these studies, the Yale School of Medicine did a study on cocaine-dependent individuals, men and women, and brain activation using MRI scans, looking at the regions of the brain and their activity, the regions that are actually linked to addiction. These participants were asked about specific situations in their lives that they found personally stressful, and they were also asked to talk about cues, behaviors related to cocaine or alcohol use and abuse. As these individuals were shown these particular cues, the study found that women's brains were more active in this particular area related to addiction when they were responding to stress-related cues as opposed to drug cues, cues associated with cocaine or alcohol use or abuse. Men responded more to drug cues. What the researchers suggest, and this was a very small study, is that women might potentially benefit from stress reduction types of programming, and men might benefit more effectively from cognitive behavioral therapy and or 12-step programs. So again, this is some beginning emerging data that simply shows that men's and women's brains are not the same, and they're not activated the same way. This next bullet really talks about two primary points. One is that there's actually a small amount of empirical data that's actually focused on the differences between female and male offenders. It's a very small amount of empirical research. A dynamic that has occurred is in the absence of that empirical research, there has been a substantial movement toward attempting to develop gender-specific programming. And this programming that's been developed is based primarily on theoretically unique or at least highly distinctive risk factors of female offenders. So to my mind, what this really suggests is that more empirical data on the differences between female and male offenders needs to be looked into, accrued, and evaluated and studied as truly gender-specific programming is developed. So again, we're brought back to the same idea that women and men are not the same. Let's take a moment and focus specifically on women, and very briefly. Women often commit property offenses, which are different than the types of offenses that men commit. Women are more likely to use drugs, and oftentimes more serious drugs. Men do experience co-occurring disorders, but women have a tendency to experience substance abuse, trauma, and mental health issues simultaneously. Also, the data from this particular study showed that 3 out of 4 of the women who participated in this study were single. They were either widowed, separated, divorced, or never married. These women also had less ability to earn a living wage through legitimate employment. And they had often experienced trauma and victimization. Men also experienced trauma, that's true, but women experienced trauma and victimization over the full course of their lifespan, more consistently than men. Let's focus momentarily on some of the factors that actually contribute to female offenders who engage in prostitution. As we mentioned earlier, socioeconomic inequities. Women don't have the same access to education, don't have the same access to gainful employment. Sometimes prostitution is the only means of these women providing for their children. We talked about trauma, and this trauma spanning their life cycle. They also experience male dominance, which can often create a cycle of induced low self-esteem and learned dependence. And this is particularly significant in regard to something that will follow, is that women offenders who engage in prostitution often either lose their support community or they didn't have one to start with. Let's talk a little bit about two very particular strategies that are currently being employed to combat prostitution. Both of these particular programs, Magdalene and Thistle Farms and the Hannah Project, are both located in Nashville, Tennessee. Magdalene is a 2-year residential community. The women who are engaged in this particular program live in this residential community for 2 full years, and they are participants in the Thistle Farms arm of this particular community, which is an entrepreneurial arm where these particular individuals work at a business producing health and beauty products that are then sold. During the course of this stay, these women have the opportunity to gain education and learn how to participate productively in an opportunity to make products, be part of a business, skills that they can actually use when they leave the community. The Hannah Project is actually a 1-day class, and I've listed the Nashville District Attorney's number because this is how you can find out more about this particular project. This 1-day class helps these women focus on how to manage some of the risks that they experience, also helps them to gain access to resources that are available to them in their community to help them deal possibly with co-occurring disorders, or also help them achieve gainful employment in ways that they're not risking their lives and or risking criminal offense. And again, I've also included the web addresses here if you want to find out more about these particular programs. Let's talk a little bit about the future in regard to female offenders who engage in prostitution. This quote from the Dallas Police Department, I think, is very indicative of how things possibly need to change as a way to actually help women escape the grip of prostitution. And it's the difference between looking at women who engage in prostitution as criminals or looking at them as victims. This particular program, this particular study, is really attempting to make a shift and help these women to get the resources, the education, and the support they need to be able to change their lives. What you should know, and you probably know already, is that we will actually be having another webinar that will follow after the second one. The third webinar will be conducted by Diana Padilla, who is a program manager here at NDRI in the Training Institute. And Diana will focus specifically on responsive strategies for women in drug court. She will go into much more detail than I have here. I just basically wanted to give you the flavor of women's issues. Dan Griffin from Griffin Recovery Enterprises will be speaking with you about specific issues pertinent to men. His webinars will be a 2-part series, like my webinar is a 2-part series. And we are about to launch our third poll. This is somewhat of a test to see how closely you've been paying attention. Okay. All right. 100% of you said that gender means that you have a vagina or a penis. That is actually incorrect. Gender means that the answer here would have been women keep house and men bring home the bacon. If you have a vagina or a penis, that is sex at birth, which is what we talked about in the beginning. Women keep house and men bring home the bacon is a cultural construct, and gender is related to a cultural construct. We'll come back to this as we proceed. Here is that slide again, simply to reinforce the relationship between gender and culture. Gender is the culturally derived and defined expectations of femaleness and maleness. The culture determines that. And presently in our culture, and predominantly in our culture at this particular time, it is defined as a binary. A for women, B for men. As I said, we'll come back to this later. You'll get a second chance at another poll. Let's focus a little bit on and about culture because of its relationship to gender. You can think of culture as a woven tapestry that includes a complex combination of threads and elements and modes of life. You can also think of it as a mosaic that's made up of all these particular pieces. And the piece I'd really like to point out here is that culture, using its value systems, often frames the fundamental rights of human beings, and traditions and beliefs help reinforce that value system and dole out those rights as the culture sees fit. The thing to also keep in mind is that cultures are actually products made by people, and they are played out as people interact with place, politics, and history, and as people are impacted by the place that they're in, the politics that surround them, the history that they're born into, or the history that occurs during their lifetime. The one thing that you might want to consider here too is that cultures do respond and change to people's realities. And I'll throw out an example of that. Today, in our culture, we have women who are mothers who actually work, and work as much as their husbands did. Now, in the past, that may have been the case as well, but I think it's fair to say that that is more predominant today than it was, let's say, even 50 years ago. And I'm curious, if someone will use their chat section, throw out what you think the driver behind this particular change is. Why do you think that women are now working when 50 years ago less women worked and stayed home and took care of children? So feel free to put that answer into your chat. And we'll see if anybody responds to that. It'll also be a good opportunity for you to practice using your question section. I'm not getting any response there, so basically I'll throw out the driver. And I don't think you'll be surprised by this. Predominantly, I think the driver is economics. Because of the changes in economics, because of the changes in the way people live, quality of life, standard of living, and again, this isn't for all people, economics have actually pushed and forced this change in a culture's definition of what a member of the culture is actually supposed to do or not do. Keep in mind that cultures and traditions can either empower people or obstruct them, oppress them or liberate them, empower or disempower them. And the key word, I think, that relates to all three of these particular aspects around culture and tradition is power. Who has power and who is in control. Cultures are very dynamic, and they dynamically impact and interact gender, because remember, we said gender is culturally defined. Cultures actually determine what men and women do. There are particular cultural expectations that are connected to men and women, such as certain characteristics they're supposed to have, certain aptitudes, and certain behaviors. And we are born into cultural environments which gender roles exist, and we learn to fulfill those roles through reinforced acceptance or consequences of not fulfilling that particular role. Culture and gender intersect and, again, dynamically relate to each other. Gender roles are also dynamic, and they can change as well. And I'll give a perfect example. I talked about how women are now working. A simple example of this is we now have stay-at-home dads, where women pursue their careers and men stay home and take care of children, or have a different type of career than may have classically been the expectation. The key thing to, I think, focus on here is that in order for cultures to survive, they have to evolve, and they impact what men and women do and are expected to do. This poll question is more of a personal question. It certainly will not be identified with you, so as you vote, we won't know how you voted. But answer this question if you feel comfortable and feel like you can. 23% of you have voted, and let's see if we can get 100%. Okay. The poll results are being shown. 50% of you, as you can see from the results, said that individuals who do not fulfill their gender role are punished. 25% are kicked out and shunned. 25% are respected. I'm glad to hear that. And 50% of you also said, although that adds up to more than 100, but 50% also on my scale say that there was an assumption that people were gay or lesbian. Change is not easy for people, and gender change can be particularly resisted. And let's talk about some of the reasons that it actually is. Gender roles actually shape our daily lives. They help us know what to do, what not to do. They help us have a better understanding of who somebody is, and they also affect a lot of people. If a gender role is to change, it can potentially affect a large number of people. Also, gender and gender roles are very intimately connected to power dynamics. I mentioned that earlier. Also, people may be pushed out of their comfort zones if gender roles change. There are some people that may have found it very difficult to make the transition from being a head of a household man who then stays home and potentially is still the head of the household, but is a stay-at-home dad, and his wife works. That there could be a cultural collision there. Also, cultures hold on to gender roles because a power structure favors the status quo, and that power structure is often based on a gender bias. People want to stay in power, they want to keep their power, and part of the way they do that is by enforcing and reinforcing gender roles. Let's talk now about some practical ways that you can address, or that perhaps you already are addressing gender in the drug court setting. First and foremost, be clear about what you're addressing. Are you considering gender in your interactions with participants, in the programming that you develop? Or are you actually looking at something else and not considering gender at all? Taking into account the context and the content of an individual participant's life. What kind of things are going on in that particular person's life? What's surrounding them? How is it impacting them? Acknowledging that relationships that individuals are in impact them. They impact their economic status. Is there domestic violence going on? Are there socioeconomic disadvantages that are causing women to engage in prostitution as the only means of taking care of themselves and their families? Is there physical and/or emotional abuse? Are people being manipulated by the relationships that they're in? And are there child care issues? Are your programs allowing people to bring their children to treatment facilities or to court? Are there limits on the number of people that they can bring? Are there limits on the number and the age of the children that can actually be brought? These things will impact people's abilities to access services and to succeed in the program. Also, considering the benefits of developing truly gender-specific programs and gender-defined groups can be very helpful as we begin to actually address gender in the drug court setting. And some people are already addressing it, which is great, and I hope that they will chime in on that when we have our question and answer period. I'd like to throw out to you a framework to consider when developing and implementing gender-responsive strategies. Now, I have to admit, and the site is in the second slide after this, that this program was actually developed and suggested for women. These principles were specifically suggested and looked at for women's programming. I attempted to degender it so we could throw out a general set of principles that people could really consider. The first one is acknowledging that gender actually makes a difference. Ask yourself, do you actually take that into consideration? And how, if you are acknowledging gender, does it actually make a difference? Is the environment that services are taking place in a safe, respectful environment that offers people dignity? Is it safe if it's a mixed group for people to talk about things that they may need to talk about that are very relevant to their recovery? And what are the benefits of having perhaps gender-segregated groups? Looking at the quality of relationships, promoting healthy connections to children, families, significant others, communities, potentially can benefit men and women and may affect them in different ways. Truly looking at the context and the content of an individual's life can help determine that. Services and supervision. Integrated services that address co-occurring disorders, according to the data, are the most effective. If someone has a substance abuse disorder and you're only treating that and they also have a mental health disorder or they need trauma-informed care, they are not receiving the best care they can if all of those pieces are not being addressed. And supervision of individuals has to also be delivered and considered in an integrated fashion. And again, as we talked about earlier, socioeconomic status is a consideration and a concern for everyone, for men and for women, and there are special considerations for women based on the cultural limitations and the cultural values and attitudes around women and work. And lastly, looking at community. Are people connected to a recovery community outside of the treatment program? Are they connected to a church community? How connected are they with their families? Are they connected to community services? These are some principles that you can actually look at when developing gender-specific strategies, programming for men or for women. And this, again, is a general framework. Some of the primary reasons that came to me as I put this webinar together and as I developed and looked through this material: potentially you're offering somebody the best opportunity to actually complete the program. If you develop programming that will specifically meet their unique needs, and again, you have to do that within the constraints of your resources or make partnerships with people who can actually deliver those services, but if you actually do that, you're giving that participant the best possible opportunity to succeed. Also, after the drug court program, the hope is that people will have successful, productive, meaningful individual and community integration, that people will actually be able to go on with their lives, succeed and achieve their goals, maintain their health, maintain their sobriety. Potentially could also lead to less recidivism, less crime committed, less revolving door back into incarceration. Using your chat feature, are there any other primary reasons that you would think are particularly important that would help people want to consider gender as part of the overall programming around gender issues in drug court settings? So go ahead and use your chat feature, and if you can think of any other primary reasons, just throw them out. Okay. Someone is saying change would be one of them. Absolutely. So that people would actually get the opportunity to change and to actually grow. All right. So using your chat feature again, let's talk a little bit about gender stereotypes. What do you think when you think of gender stereotypes in our culture today? And again, binary gender stereotypes. A for women, B for men. What are some of the stereotypes that you think exist in our culture today? I'll give you an example. The whole notion of blondes have more fun. That's a particular binary gender stereotype in some ways. That was referring to women. And it also was suggesting how women should behave if they wanted to be looked at or perceived in a particular way. And keep in mind that that was also from a Clairol ad, so it was economically driven to sell a product to women. Any other stereotypes that you might come up with? Education and more civil rights. I see that that is also an answer to the prior question. Absolutely, people can get education and have more civil rights. Changing economics and moves by women more fully participate in the workforce? Absolutely. Again, these are more answers to the earlier question. I have a question here from somebody who's asking if I'm suggesting that letting women, does this mean letting children come into drug court if there's no child care provided? I think that each drug court is going to have to work that out for themselves. And again, the suggestion is that you really look at, if you want women to participate in a productive way, what's the way to do that? Aha, and now we have some responses in regard to the stereotypes. Women are emotional, men are stronger, men shouldn't cry. Males are more assertive than women, and men make hard decisions. Women shouldn't be angry. Excellent. These are all excellent. Blue is for boys and pink is for girls. Excellent. Good. Your lists are better than mine. Pink baby blanket for girls. Females are homemakers and caregivers. They're silent followers. Women pull the strings, but they do it behind the scenes. They're weak. They cry. They show emotions. Women should keep their legs crossed and be a lady. Women have to be beautiful all the time. If a woman has multiple sex partners, she's considered a whore or she's considered loose. And women can touch other women. Male stereotypes include a blue baby blanket. Men are breadwinners, in-charge leaders, they rule the world, they're strong, they don't cry. Acceptable to have many female sex partners, do not, should not, don't touch other men. Again, broad stereotypes. You may recall the picture of this particular infant earlier on. Many of you suggested, 50% of you I believe suggested that this was the gender of this child was male. I'm wondering, how many of you base that on the baby blanket? It's a pale blue, but it's blue. Raise your hand if you based it on the baby blanket. I see that Debbie did. I see that Suzanne did. Nancy did as well. This is a prime example, and a very simple one, of the cultural impact. Even infants are being told through the blanket they're giving, as well as all the people around them, what their sex at birth is. And that is a cultural gender construct. We'll have another poll here. Excellent. So, gender is what culture says women should look like and do. And of the people who voted, 100% correct. Wonderful. That's great. Thank you very much for participating in that poll. Just a couple of more things to consider about culture. People form and are influenced by their cultures. People are also responsible for changing them and participate in changing them and resist cultural values, attitudes, beliefs, and traditions. And they also reinforce traditions, attitudes, values, beliefs, and power structures by conforming to the cultural prescription. Cultures have to change to survive. And a great example of that at this particular point is cultures will often hold value judgments, and they'll keep those value judgments and make decisions about what they're going to let go of or what they're going to add. An example of changing value judgments is the greater visibility of LGBT people in our culture at this particular time. Education also equips people to make choices about whether they actually want to conform to cultural prescriptions or whether they want to resist them. And cultures actually can only survive if they are based on resiliency and adaptation. And again, we talked about the reasons why people might not want to change in a particular culture. So I noted that there were some people that had questions, and let's actually go to questions at this particular point. Alrighty. I'm checking the question window to see if there are questions. Question. Nationally, is graduation rate higher for programs that have gender-specific programs? I don't have a definitive answer to that, and what I can say at this particular point that I know is that the jury is still out, and again I talked about the lack of empirical data. The jury is actually at this point still out about the effectiveness of gender-specific programming, and again that's not because it may not be effective, but it's because there hasn't been enough empirical research on it. But some programs have shown that if programming is specifically created for the gender that it's being used with, people have a tendency to be more successful in that particular program. Is there value, this is another question, is there value to having men and women in the same group? I think that there could potentially be value to that. It would depend on what the purpose of the group was. If the group was to help people talk about relationships between men and women, very possibly yes, but it would depend on the purpose of the group, and it would also depend on the composition of the group. Any other questions at this point? What was the sex of those two babies? I'm glad that you asked that. What I can tell you is I honestly don't know. And ultimately, what matters is the attribution that we would make upon seeing them. And again, some people identified that what they did is they saw the blue blanket, and because of that cultural signifier, they decided what sex the baby was. Other questions? Again, a lot of questions. I see another question about should children be brought, if I'm understanding it correctly, should children be brought into groups if there's no child care to be provided? Again, that's something you'll really want to think through specifically for your unique drug court setting. And it truly is dependent upon the resources that you have and what is going to work with your staff in your particular drug court. All right, going once, going twice for any more questions? All right, we will now begin to bring this webinar to a close. We have one more poll. All right. So again, of the people that voted, and I believe they will be shown to you momentarily, 100% of you said addressing gender can support program completion. And did anybody have anything that they wanted to write in? The next webinar, we're going to talk more about gender, but again, I want to reinforce that gender is usually thought about as binary, A and B, and hopefully from this webinar and the one that will follow, we can really think about gender as a journey and not a destination. Gender can be A to Z and even beyond Z. And we'll also talk about sexual orientation and its relationship to gender and its lack of relationship to gender. The next webinar is called Gender More Than Male or Female. I will be presenting that webinar, and I'm showing you this photograph because it will appear again in the next webinar, and I will ask people to name the movie or the character. So in some ways, I guess I'm giving you a little bit of homework. And if you think you can name the character in the movie now, raise your hand. All right, it doesn't seem like anybody can. So I'll see what homework. Please, I'm getting a note from Nancy, please give more time to vote in the future. Will do, Nancy. Thank you for that feedback, and we will certainly incorporate it. Now, if you've met this person before, please raise your hand. Take a good look and see if you've actually met this person before. And again, feel free to raise your hand. I don't see anyone raising their hand. I will tell you, and hopefully I've given enough time to do that, I will tell you, you actually have met this person before. Do you remember this picture? If you remember this picture, raise your hand. Yes, I see hands going up. This is the same person. This is Mayor Stu Rasmussen, one of the first openly transgender male-to-female mayors in the United States. And I offer you this particular photograph of Stu as, again, a reminder of that gender is very fluid and changing. And we'll come back to that more as we explore deeper in the next webinar. Again, I'd like to thank BJA, American University, for the opportunity to do this particular webinar. I look very forward to doing the next one. I thank you for your participation. And we do ask you to please complete the survey for today's webinar. I'd also like to thank Clyde Frederick, who is our webinar organizer for today. And I look forward to seeing you next week.